It's time now for the Gem Young Wealthcast. Brought to you by Gem Young Insurance and Wealth Advisors, a family-owned independent insurance and financial planning agency since 1947. Now, from their studio on Star Center Drive in Canfield, Ohio, here's the host of your program, Leo Daprile.
Welcome to the Gem Young Wealthcast. This is Leo Daprile, and yes, we are doing it from our studio in Canfield, and yes, it is my office that we painstakingly convert to a studio every time we do a podcast. So today we are continuing our series on aging in place to assisted living to nursing homes and the financial impacts. We've talked about that. We had Joe Johnson, an estate planning attorney, on where we spoke about the legal implications of what you do, and more importantly, what you didn't do and what you should do. So today we're taking the route of the medical field, and we have with us from Maplecrest Nursing and Rehabilitation, we have Clint Ansell and Tiffany Crane. Hey guys, welcome.
Thank you.
Thank you for having us.
Thanks for coming in today. Thanks for letting me punish you, more importantly.
Absolutely.
So this whole series that we're doing is about the conversations people should have, but people don't. And one of the themes through this series is when someone has to put a loved one or a relative into a nursing home, when they get to that point, whether they're a caregiver, and I see it with my financial planning clients, that's sort of what's the genesis for this series, is there's a lot of guilt that goes with it. It's something people think about, but it's not something people talk about, right? So, and then you guys have to come in the middle of, in many cases, I would suspect, highly emotional people making highly emotional decisions, and how do you navigate through that, right? So is that a fair assessment of kind of where your life is at sometimes?
Yes.
Oh, yeah, definitely.
Okay. So let me start, Clint, with you, the transition, because here's conversations that I hear in my practice where people say, I'll take care of mom and dad, right? And we're going to do our best to take care of them. And there's aging in place strategies. For instance, I gave the example that I recently bought an LG refrigerator and it has Wi-Fi on it. And first I'm like, well, this is kind of stupid. You know, who needs Wi-Fi on the refrigerator? Then I got to thinking about it and said, well, if mom and dad want to age in place, and if you want to see whether they left their Wi-Fi stove on or the refrigerator door open, you could have these products, you could download the app, and you can kind of keep track of things. So I thought that was an interesting way to use technology to help people age in place.
Yeah.
You know, I've had some clients tell me that they've installed cameras in their parents' kitchen to make sure they do those things. I've had clients tell me they've put devices on their water meters to see if they've left the water running. So there's all these things, but at some point when you're doing those things, the person you're doing them for is declining, right? And we've talked in past episodes in this series of when does aging in place become the detriment, okay? When does it become unsafe for that person? And caregivers, typically out of love, don't want to give up, but know they have to because it's starting to kill them, right? Or destroy their quality of life, right? So I'll start, Clint, with you from the aging in place to the assisted living to the nursing home. What kind of trend lines do you see on that, or how do people behave in those? And then Tiffany, I'm going to come back to you because as the admissions coordinator, this is where you're getting people when things are hot. I asked 15 questions at once, so pick whichever one you want to take first.
Well, I think, as you referenced, it's an extreme challenge to care for another human being. And obviously you want to do everything you can for a loved one. You want them to stay in their home. You want them to have something that you may have promised them years ago that, we're never going to put you in a facility. We're going to make sure we take care of you. We're going to do everything we can for you. But a lot of these folks go into that and they don't really understand the level of work that it takes to care for another person around the clock, 24/7. And over the course of time, as you mentioned, that wears on a person, especially if this individual, has children of their own. They have a career that they're trying to manage. Maybe they don't have sibling support or other family support to help them. And then it just gets to the point to where it, mentally, physically, emotionally, it's just too challenging for the person. So then they begin to have to look. And they still go into that very apprehensive and usually with some guilt. And, of course, you had some financial folks on, folks. There's a financial component to all of this as well, too, right?
Absolutely.
When you're talking about estates and money and all of those important things in people's lives. And, there's just a lot of unknowns for people as they start to head into this, part of their lives. So the stress can definitely wear on an individual. And that's where we come into play to try to help manage that as best we can and provide the comfort they need and guide them as best as possible.
So you said something, Clint, that really resonated with me. And I'm sure a lot of listeners have said, I promise you I won't put you in a nursing home. And then until they get to the level of work. As many of the listeners know that my first wife passed away from breast cancer. And the last 2 months of her life was pretty much 24-hour-a-day care that I provided. So I was a caregiver for 2 months. And boy, was that a difficult job to do. I'm glad I did it, but it wore me down because you're never up for air. So by the time they've made that decision where they're coming to a nursing home scenario, Tiffany, tell me about those initial interactions and tell me about what you hear from the other side.
Right. And it's hard. You're right. I mean, taking care of someone, being someone's sole caregiver is a lot. A lot of times when I get a hold of a family, it's usually a crisis situation. Someone fell or there's some type of acute illness that require them to be hospitalized. A lot of times they do just need rehabilitation just to get them back to that level of independence and confidence so that they could safely transition back home. But there's also on the same side, there's those that it's not going to be safe for them to transition back home. So that's when we kind of need to discuss transitioning to long-term care. And it's a hard topic to discuss with families when it's a crisis situation. So that's why we usually like to recommend them doing planning, beforehand. That way they kind of have their ducks in a row and know, what to expect.
So when somebody's in that situation, and I don't want to make this a Medicare show because I'll bring in Medicare people to do that. But when they're in for rehabilitation, it's only the first 20 days where there's Medicare coverage. And after that, it goes to a copay scenario, right?
Majority of the time, yes.
It varies by the product.
Okay.
The insurance, whether it's traditional Medicare or you have a managed care product, which most folks now have managed care products, and those are all different.
Okay. So you're evaluating this. So tell me from the time, correct me if I'm wrong, because I think this is an old number anyhow, that from the time somebody has to make a rehabilitation decision or a long-term care decision, it's like 72 hours, right?
From hospital admission?
Yeah.
So it just depends. Honestly, it depends on the census at the hospital. It depends on what level, of care they require. A lot of times they meet with a social worker within 12 hours of admission, and they are to start the process of choosing a facility at that time. And that's, a time where a family, again, this is a crisis. So you're coming to them with a list of facilities that you want them to pick, and you pretty much give them 24 hours to pick a facility to place their loved one at.
And this is exactly why I wanted to do this show, because this is crisis level decisions.
Right.
It's reactive level decisions. It's having to pick a rehabilitation facility, and nobody has the person having to choose, in many cases, has no knowledge on how to pick it, right? So it's almost kind of from their point of view, throwing a dart against the wall saying, okay, well, let's try this, right?
Right. Yeah, absolutely. They're given a list of facilities with ratings that they don't necessarily understand how the rating system even works. So, yeah, it's definitely, they're kind of flying blind.
Yeah. And this is, again, exactly why I wanted to have this conversation, because I hear this over and over again that I had to put mom or dad in a nursing home. It was tough. They fell. They broke their hip. Now they're going into rehab. I don't know what to pick. I had an experience with a family member that was being put into a rehab facility and wasn't really in the state of mind to pick it, and neither was his wife. So they just picked something because they had known the name, and that's all they knew about it. And the place was awful. and whether there was ratings or anything to pick with, neither one of them was, but they were each other's medical POAs. So there wasn't much anybody else could do but kind of sit back, right, and let them decide what they wanted to do. So I'm sure you see that a lot, when they get in there. So your recommendations, either one of you can speak to this. What do you recommend people do? Like if mom and dad are starting to decline, from a financial planner's point of view, I'm a big advocate that there should be transparency with the beneficiaries of your estate. Because I always say, don't leave it open to interpretation of a legal document, because everybody can interpret a legal document different. So when I have my clients have their estate plans constructed, I recommend, and I do this for them, I'll facilitate a family meeting to say, here's mom and dad's intent, not just the document. Here's what they want to accomplish so that and it goes a long way towards reducing family stress. It preserves family relationships. But this conversation, it's always difficult for people to talk about their own mortality. One of the topics I brought up on one of the previous shows was I spent a lot of years in the life insurance business. That's, it's death insurance, but they prettied up by calling it life insurance, right? Because calling it death insurance really sounds morbid, doesn't it?
Yeah.
I kind of call it as it is.
Yeah.
Clint knows that he's done this with me before, right? So talking about mortality is never fun, but this is one of the 100% guarantees it happens. Do you counsel families to say, should you be having part of your plan? And this is becoming a thing for me where I'm starting to have conversations with my clients of saying, not just having the legal documents in place, but if you talked about if I have to be in a nursing home, where I want to go. What's criteria should there be for making sure I'm in an effective rehab facility if I have to go? Because those decisions are no longer theirs, right?
No, absolutely. Yeah. And unfortunately, in our world, by the time they get to us, if those decisions aren't in place, it's too late. Mm-hmm. And it's very difficult to then try to go back and make those decisions. It just makes it more challenging for sure.
So what goes and Tiffany, when people are deciding on a rehab facility or long-term care, what goes through their mind? What kind of questions do they ask you?
A lot of families, I suggest touring first. If I know that a lot of times I'll get a phone call, like my mother's in the hospital. So right out of the gate, I say, come in, tour, get to know our facility. You don't have to make a decision to come to, Maplecrest, but at least have an idea of what you're going to, where you're placing your loved one. So I suggest them coming into tour. Then we just start to discuss what their goal is. Is this going to possibly be a long-term placement? Letting them know what their options are as far as like semi-private rooms, private rooms, payments, what to expect every day. Trying to keep their, activities of daily living similar to what they were doing at home. Such as like activities, like letting them know what we offer for each individual, high functioning versus low functioning residents, how much we're able to assist with memory care, things like that. So those are all conversations we have, hopefully before a person admits. That way families know what to expect. But a lot of times if they're placed from the hospital, we don't have time to have those conversations. That's why it's important for families to have them, amongst themselves before things like this happen.
And I'm going to speak to caregivers with this question. So let's answer it for their benefit. So when you're caregiving, we talk, I say all the time, anytime you deal with anything with the government, there's an acronym involved, right? Especially in the Medicare game, because we started a Medicare distribution channel a couple of years ago. And for us to be paid on it, I have to be licensed as well on it. So I go through all the training for that. It's an acronym fest. And you got to remember what all that. So one of the acronyms in this business are ADLs.
Yep. Activities
of daily living, right? So if you're a caregiver, what activities of daily living should you be watching for that start to become a detriment for somebody to stay at home?
Medication management. How, are they taking their medications? Are they eating? Are they safely walking down the hall? Are they tripping over things? Are they more forgetful? Those are all things that start to show a decline. And that's when it's the time now to have those conversations and just to really have an idea of what your family member would want. You can't honor their wishes if you don't know what they are. So just paying attention to those slow changes, or sometimes they may be fast changes, but just being observant is the most important.
And I would think, so I'm trying to change how people think. That's my objective with this series. And I want to change how people behave with this series. And I want to have more upfront discussions with aging parents. And that's my example. I know it's aging other people, but in this case, it's aging parents. That seems to be the predominant challenge of having conversations when people are still with it by saying, if you start to decline, let's talk about what that looks like. Let's talk about what that progression looks like. And let's talk about when I need to step off and bring in assisted living or long-term care along the way. That's kind of where I'm coming from. That's where I want to start changing the conversation for people, or at least start having it, right? Mm-hmm. Right, because if the guilt lays with the person making the decision, which is typically the prior caregiver, right? That's that, and then people have regret that they couldn't, right?
100%, yes.
And do you find that, because I've heard this many times, is once they put them into a long-term care facility, in many cases they improve because of the amount of care.
They could, yeah. We've seen it, yes.
Right. I mean, in many cases we see it from I hear that from a social point of view.
Right.
Because typically when you're aging in place at home, it becomes very isolating.
Very.
Right? And in today's world, a lot of the people that are coming into the long-term care facilities, they're older. In many cases, they've buried most of their friends. So their life has become very isolating, which in my opinion, because we're also what we talk about in our financial planning practice is not how long you live necessarily, but what was the quality of your life, right?
Correct.
Along the way.
Mm-hmm.
And so shooting for that big number, because I say this all the time on the show, if you had a number that you lived to 95, but the last 7 were lousy, who cares, right? So if you can be in a situation, so anyhow, I see so many benefits to long-term care facilities, but I think people look at it with dread. So that's the other thing I want to do is kind of start changing the perspective, right, of what the quality of life for that person is, Even if you had the promise that you're going to take care of them and let them die in their own home, did you really do them that service? So
Right.
It's no different than when I have conversations with my clients and we start having these conversations with their kids about who's going to get what. And the kids go, I don't want any money. Well, I'm like, you're going to get it. So let's talk about it. This is going to happen. Mm-hmm. So let's have the conversation that nobody wants to have. Right? So the rehabilitation business really has become a big thing in the last 10 or 15 years, hasn't it?
Oh, yeah, for sure. Probably even maybe a little longer than that.
Okay. And that I looked at got prompted by Medicare wanting people out of the hospital and wanting to reduce cost to get people well. Is that correct?
Exactly.
Okay. So, and then I know you guys added a rehabilitation facility because of that. Okay. Is it busy for you guys?
Yeah, it stays pretty busy. The dynamic has changed quite a bit for our facility. We see quite a bit more of the short-term in and out rehabilitation, anywhere from 10 to 20 days typically, with most managed care products. So yeah, the turnaround it's pretty rapid. It makes it difficult at times though, because a lot of times the insurance company makes the decision for you, and you may not necessarily be ready to discharge back to the community, or your caregiver might not be ready for you to discharge back to the community. That makes a very difficult financial decision then. So if you want to have to transition to the nursing home in a long-term setting, there's financial implications to that. So those are all conversations that families have to have as well.
And it's back to that crisis scenario that I talked about. Okay.
Absolutely. And we see families that, there's a lot of times we see families that the children have no idea. They don't have any idea what mom and dad have, where their money is. They don't have access to it. We see all those types of dynamics.
Me too. And that's why this is part of my personal crusade, that people need to talk more about things. And I get it as people get older, that years and years ago, I had a friend that was a nursing home administrator. I'm talking like 40 years ago. But he had what he called his theory of loss. And his theory of loss was, as people aged and they began to lose their faculties in different things, they would hold on tighter to what they can control. And the last thing that they had control over was their money. So that was the last thing they would talk about or let go. So, and I see that in a lot of cases. So to have control of it means nobody should know about it, right? So then it leads itself to conversations where we had this recently, and this was a family member that passed that was pretty well off. His kids lived in other states, but he lived a modest life, and he needed to go into a rehabilitation facility. And they were calling me saying, we don't think Dad has the money to pay for this. He never told him. And this is a bright, educated individual, with a close relationship with his children, that never had a money conversation with them, other than saying, if something happens to me, you're the power of attorney. And that's where his financial conversation stopped. Tiffany, I know you're shaking your head, but that's really common.
Oh, yeah.
I mean, in our business, and that's when I keep pushing, your kids need to know. And, and some resist and say,
we have wives that don't know.
Yeah.
I mean, with their husband, the wives have no access to the financial side. Yeah. You see,
that
see
still
those things a
happens
lot
today. Wow. Wow. Okay. And now that's somebody having to make a crisis decision that doesn't know their financial situation.
That's never managed anything financially in their household for their entire marriage.
Yeah.
So then they're left trying to figure all of these things out.
I have several women that are clients that actually went through that scenario, that were told during their life, that says, I don't know what's going on. They said, it's okay, I have it. They weren't being mean. They weren't being domineering. They're just, that was my job, I'll handle it. And in both cases, they said, if anything happens to me, just call Leo. So, and by the way, one of them wasn't my client at the time. They were handling their own things. So he knew I would clean it up.
Yeah.
Which I did. So these are the interesting emotional factors of what happens, right, when in this situation and people are having to make these decisions. So this is what I want our listeners to hear. This is what really happens in the world, and this is especially if you have somebody that doesn't understand the financial scenario, they're potentially making some really lousy decisions, right? Okay. All right, guys, believe it or not, it's time for me to take a break. So I have with me Clint Ansell and Tiffany Crane from Maplecrest Nursing and Rehabilitation. This is Leo Daprile. This is the Gem Young Wealthcast. We'll be back after this break.
Insurance and Wealth Advisors, we make planning for your future simple by offering both insurance and wealth management under one roof. Our team helps protect what matters most while guiding you toward your financial goals, whether it's safeguarding your home, health, business, or planning for a work-optional lifestyle. With everything in one place, you get seamless support, personalized strategies, and peace of mind. Call Gem Young Insurance and Wealth Advisors at 330-533-7941 today to schedule your fit meeting and experience all-in-one protection and planning.
Hey there, this is Dan Rivers. Friends, if you're planning for a work optional lifestyle or looking for financial insight or just want real conversations that help you make smarter decisions, we've got you covered. Listen to the Gem Young Wealthcast anywhere you get your podcasts, including Apple Podcasts, Spotify, and the iHeart app. And now you can watch the full video podcast on their YouTube channel. Gem Young Wealthcast with Leo. New episodes every week featuring professionals, local leaders, and conversations that matter.
At Gem Young Insurance and Wealth Advisors, we know insurance can feel complicated and overwhelming. That's why our team is here to listen, understand your unique situation, and provide solutions that work for you. From home and auto to life, plus a team dedicated just to commercial insurance, we help protect what matters most without the stress. Don't wait until an issue arises. Call Gem Young Insurance and Wealth Advisors at 330-533-7941 to schedule your fit meeting and get the protection you need today.
Now, back to the Gem Young Wealthcast, brought to you by Gem Young Insurance and Wealth Advisors. Once again, here's Leo Daprile.
Welcome back to the Gem Young Wealthcast. This is Leo Daprile. If you're just joining the program today, this is our third part in our series of aging in place to assisted living to long-term care facilities and the conversations we don't have. Again, week one, and just check out our podcast. It's available anywhere you get your podcast, or check out our YouTube channel for the Wealthcast, the Gem Young Wealthcast with Leo. For our previous episodes where we talked about the implications of aging in place, assisted living, and long-term care to your financial plans, we had Joe Johnson in, an estate planning attorney, and we've spoken of those implications. Now in our third set here, we're actually talking to the folks that handle rehabilitation, long-term care. And we have Clint Ansel, Tiffany Crane from Maplecrest Nursing and Rehabilitation. Really easy for me to say, wasn't it? So, and also we dragged their boss in. Hello, Lisa.
Hello, Leo. How are you?
Good. I have Lisa Daprile here. She is the owner of Maplecrest Nursing and Rehabilitation. So she just came in to say hi, and then we just made her sit down and put a mic in front of her, and she's kind of thrilled with me.
Yeah, always, yes. Got roped in a little bit, but that's okay.
Well, I wanted it because...
Happy to be here.
Well, glad to have you. So in the first segment, we spoke about, the challenges of aging in place and when aging in place becomes a detriment to someone. We were speaking about the emotional implications of, as people age, the conversations they don't have. And promises people make to take care of their aging parents, and when they get to the point where they can no longer do it, and the guilt that goes along with it, to the point of when they have to consider either a long-term care stay or a rehabilitation stay. It's a crisis decision. It's an emotional time. And one of my goals here, Lisa, is to start having people talk about this before they're in those situations. So that's
absolutely. So
that's kind of what the mission of this whole monthly series we're doing on aging in place versus skilled nursing facility and to long-term care facilities. Start having these conversations so that people can manage expectations. No different than how they manage their money, right? They should be communicating transparently with their beneficiaries what the parents would expect, for instance, with their kids. So from a nursing home owner point of view, and I'll ask if we get into more specific regulatory challenges, I'll flip that back to you, Clint, because I know that's more of what you manage on a daily basis of that too. A lot of trends been changing. We spoke a little bit in the first segment too about the changing rehabilitation business,
right?
And how more prevalent that's become, and how unpredictable the payment from different insurance companies and different insurance plans makes every case unique. Right, so there's no standardization for people to think. That's Clint earlier. That's the message I want people to take away from that. Is just because somebody said the first 20 days is covered, don't take that as the gospel. You better make sure whatever insurance plan you have. And then to your point earlier, Clint, that even if you have those coverage, the amount of time that you're actually there is determined by the insurance company, not what's medically best for that person or what happens to them after. Like you said, and this is a great point. If someone goes home because they have to go home because there's no more insurance coverage, and the caregivers aren't prepared to handle that or take care of them, there's all these other emotional elements that go along with this other than should they be here and what's it cost, right? Should they be there? Are they safe there? Which is also a big consideration as well. Yeah, I agree. Lisa, we spoke about that a little bit. So from your perspective, where you see things as an owner, where do you see your business changing, and how do you manage your business because of that? Well, as you said, every family, every individual, every decision is unique. Not one of them is the same. So many times we'll get calls from people that say, well, this person did this or that, and this was covered, and why am I not covered? Every
person has a different plan, different financial resources available to them, different caregiving opportunities available to them. So from our perspective, we really try to look at the individual and at the family too, to see what's going to meet their needs the best.
So let me ask you this question. A business owner to business owner, what I'm hearing a lot of, and from Clint and from you, is you have a wildly volatile revenue stream.
Well, that's an understatement,
Yeah.
for sure. Yes,
So-
absolutely.
So that has to be an enormous challenge to just running your facility. Because
Absolutely.
you can say, okay, here's my fixed expenses, right, month to month, but you really don't have control of what that income is month to month.
No, not at all. And especially now as there's a plethora of Medicare Advantage plans in place that actually market to individuals, and you probably see the commercials all the time on TV promising all these wonderful things. But when you get to a decision point of having to choose a facility or staying at home, I mean, those benefits may not be there as part of that plan. So as you touched on in your opening, was that, you really need to look at the plans that you have in place and see where you're going, what's out there for you.
Right. So, and you two are now sharing a mic. So if you hear mic noise, it's because I'm having them swap a mic back and forth so that we can jump in on these guys, right? So Clint, how are you, because you're probably tasked with trying to figure out the income and expense side as well, right? And dealing with different insurance companies. We won't use insurance company names, but I know there's some that are not your favorite, right? And there's some pretty large companies that are not your favorite, right? Yeah, because I've had this conversation with my brother, and he told me who one of them was. But I'm not bashing companies. I'm bringing it up because these create challenges on coverage. These create challenges on level and quality of care, right? And based on what, to Lisa, the point you brought up, and Tiffany, you brought up at the beginning of the show, anybody coming in, for instance, for rehabilitation, it's a customized plan based on what they did, what broke, what needs fixed, what needs rehabbed, right? And then at the end of the day, you have the insurance company dictating what they're going to provide or what you're going to provide, right? Is that accurate, Clint?
Yeah, they absolutely. They basically will have based on the diagnosis of the individual, kind of a preconceived plan of what the amount of therapy minutes that individual may need, what their estimated discharge, date is going to be. I mean, they know that all in advance. They kind of use these algorithms that they have, again, based off of clinical diagnoses. They take the human element almost completely out of the equation, and they make a determination based strictly on diagnosis and progress. And as we all know, everybody's different. Everybody heals differently. Some people take a little longer than others, but they kind of have these numbers in mind. And us as providers, if we don't meet those, quite frankly, they don't want to work with us, right? So, in order to stay in their network, you have to meet their numbers. And
So that would have been my follow-up question to you, filing an appeal for somebody that's not ready to be discharged, right? Yeah. So they don't look at that necessarily as, I want listeners to understand the business side of what happens behind the scenes that controls their coverage and controls maybe their outcome. So that's why this is an interesting discussion.
Well, I have to say at Maplecrest, I mean, we are always looking at them individual, and we do our best to fight for them, and we file appeal after appeal after appeal as it's necessary to make sure they're getting the care they need. But on our end, that is a big job to make sure all the paperwork and all the assessments are in place to document why we feel they need to extend beyond 20 days, and they may give us another 2 days or another 5 days, correct?
Yeah, typically, if somebody receives a cut from their insurance and they choose to appeal it, if they do win the appeal, they give them a few more days and then they cut them again. That's the typical practice for most of the insurance companies. And then they can appeal again. Likely the second appeal is probably not going to happen. They'll probably lose at that point. So from the start of their stay, we're already working on their discharge. So we've started that process from day one. We kind of have a goal in mind. We know, we communicate to them very thoroughly up front what the expectations are, how long we think the insurance company will likely cover them. We let them know that obviously, it's not our decision and when their stay is going to end. It's going to be driven by the insurance company. But we try to have those conversations up front so they can try to be as prepared. And we do that, and oftentimes they'll get to the point when it's actually happening. Then that's when we're talking about emotions, and it kind of the realization sets in right at that point. Like, oh no, what am I going to do? Mom or dad's coming home tomorrow, and I have to be at work.
Right. I bring this up, and this is my complaint with the insurance industry that I'm part of. And I actually did a series of shows back in May on people that are buying on price. So we did 4 shows on different examples of why, when you say I'm switching my auto insurance because I got it cheaper somewhere else, people don't read contract language. And one of the things I hate about the insurance industry is we call contracts policies. They're contracts. And once you sign that contract, and if you didn't read the contract, people don't complain about an insurance company till they have a claim, because people assume all contracts are the same and have the same coverage, right?
Correct.
That is true.
I deal with this every day. And till we point out, for instance, in the auto home business, the new game in the homeowners business is if you have roof damage, they don't have to. The new contracts out today don't have to replace your whole roof. They just have to get close. And I ask everybody, have you read your contract to see that? Because I have, and I see that. That's why it's cheaper. So the same is true, because as we were talking in the earlier segment, we got into the Medicare Advantage distribution channel a couple of years ago, and the contracts are all different. So my point is I'm relating to people that say I'm buying my auto and home on price to I'm buying my Medicare Advantage plan because I got it cheaper from Aetna than I did from Anthem. And the question always is, what did you give up to get it?
Right. And your needs at 65 and 70 may not be the same as your needs at 80, 85.
That's
either.
correct. Good point.
So you have to really evaluate those plans on a year-to-year basis to make sure as you are aging, and we talk about aging in place, what is that going to give me if I do need a stay in a skilled facility or a rehab facility? What is it going to help me rehabilitate as best as I can?
Right. And if I made a decision on price and didn't pay attention to the contract, what's the financial implications to me?
Correct.
Right. And we're not talking hundreds of dollars. We're talking tens of thousands, maybe hundreds of thousands of dollars of services not covered.
Right. And the next step after the 20 days, too, is a lot of times co-insurance kicks in, and families may not understand that and may not know that they are going to be responsible. They may have to stay in our building, and it may have come at a cost to them, out of pocket.
Lisa, I'll answer that this way. People know when Jerry, he's our Medicare Advantage professional, when he asks people about what do they think nursing home care's coverage in a curiosity way, he says, well, I know we have some coverage for 100 days, and I know there's some copays in there. That's where the conversation stops.
Right.
So then he goes, let's cost it out.
Right.
Let's cost it out based just on the copays, what those 100 days cost you.
Right.
It's eye-popping. If you really take a look at it, it's eye-popping. Again, these are things people don't talk about. And again, the whole point of the show was it's too late. If you haven't talked and thought about these things when you are making decisions, it's simply too late. It's just going to be what it is. So, Tiffany, I'm going to flip the mic back to you because I want to ask you a question. When you're doing I'll let him flip that first so you can focus on it.
Okay.
So when you're performing an intake, and then maybe I'll bounce this between the two of you because you're evaluating the intake. So there's simple mind answer from me. There's 3 outcomes when they're done. They're either going back home, they're not well enough to go back home, or maybe they've been debilitated enough where it's an assisted living facility. And if it's worse than that, then it's going to a long-term care facility. Is that a fair assessment?
It is. When I get the referral, which is, the person that needs the care, when I get that information from the hospital, it's usually they know already that this person is not safe enough to go home and they need to go to a facility.
So how do you evaluate, and maybe take a minute and either one of you can answer it, how you evaluate the difference between assisted living and long-term care?
It's based off the amount of assistance you require.
Okay.
So if you need more than, I believe it's like 70% is skilled nursing. I'm not exactly sure of the number,
Okay.
but if you require like a Hoyer lift, if you have any wounds, any medications that need to be administered more than like twice a day, then you're skilled nursing criteria.
Okay.
If you just need, if your if your loved one is able to provide that care at home, it's similar to assisted living.
Got it. Okay.
There's a big difference between the two levels of care, and it all comes down to what level of care is needed for that person. And we have to keep in mind that assisted living's really, they have some nursing care, but not nearly the extent of care that we provide in a skilled building.
Right. Because I'm wondering how people make the decision of saying, I got to stop being a caregiver because it's too much for me, but assisted living's there. Or do most people that are caregiving wait till they're so exhausted and the person has declined so much that it's right to long-term care?
Well, that's your question goes in line to something I was thinking, that right now we've only been talking that Medicare resident or Medicare patient that's coming out of the hospital with, let's say, a skilled nursing need. Broken hip, broken knee, cardiac rehab, whatever their issues are. But there's also those people that that just need care, that maybe someone has been caring for them at home and they're coming to us directly from home. That's a totally different payer source because Medicare will not cover any of that stay. Those people that are coming to us at that point are either private pay or, then they are Medicaid, maybe they're Medicaid in the community, or they get to our building and they have to switch over to a Medicaid payer source. Medicaid as a payer source, I should say.
Or have a long-term care policy that they maybe already had established.
A long-term care policy, right.
Right. And we actually did a show on that about long-term care products today and in the market. We just did a show. This was part of the financial part of it when we did the financial segment to the show. And when we're talking to our financial planning clients, every time long-term care or nursing home fear comes up, one of the things, and Stephen and I had that conversation, and with our software, our financial planning software, we model nursing home stays to see what financial impact it would have on their plan. And we model out using an average nursing home stay of 2 to 3 years, because we know, I think it's around 22 months is the average right now. Is that numbers you guys agree with?
Oh, we've had residents quite longer than that.
Yeah. But we use that as an average. And then we're using $12,000 a month as a nursing home stay. So we model that, and we pick an age of when we think they'll go in, and one spouse goes in, and we model that out, and then the other spouse going in to see the implication. And then from there, we determine whether a long-term care product or solution makes sense. But the interesting thing that happened along the way in the insurance business from the long-term care point of view, that we talked, I'll just to give you guys a recap because this impacts you guys and why so many people today don't really have long-term care policies, is when insurance companies would price products and when the long-term care industry got going, insurance companies do what they call lapse pricing. In other words, they expect every year a certain percentage of people to lapse their policy or cancel their policy. Well, back in the 90s, this was actually almost bankrupted not GM, what am I thinking? I'll think of the name, but they were the biggest underwriter of long-term care policies. Okay, GE was. Nobody lapsed their policies, so they had to spin off their division. They had to come up with like $7 billion to fund the liabilities. The problem with most long-term care policies now, they're not really providing coverage; they're providing buckets of money. Okay, and many times over 20 years, you almost pay for that bucket of money. And they don't make sense for a 65-year-old to buy them because they're too expensive. So you should be buying them when you're 55, and by the time you might use it at 80 or 82, what'd you have, right? So people say, well, I'll just save myself for that. The problem is most people don't.
Right.
So it just exacerbates the problem.
Right. And planning for the long-term care stay has to happen years ahead of time. That's the one thing I can advise people is that start planning that might happen down the road. And what can I do to minimize the financial impact of that decision?
Lisa, we've actually had with some of our clients that have that fear, we've actually allocated some of their investments to a long-term care bucket.
Okay.
And we're managing a long-term care bucket to help them, because especially if they're in their early 60s, to say, we're just going to allocate this. We're not going to put that as part of your financial plan for you to live on, okay? And if you're getting to the point where, everything else is doing well and you've been successful enough where you can maybe self-insure, then you can start spending it. So that's one of the ways we're attacking it. So we're having those conversations that people should be having, but we're not having the deep conversations about what really happens, and that's why we're doing these programs.
Right.
So that people know more about it.
You brought up assisted living. I mean, keep in mind that most assisted living facilities are all private pay. It's a lower cost. It was initiated as a lower cost opportunity for people to get some assistance with care, but they don't get the level of care. It's a lower level of care than what we would provide.
Got it.
And I mean, there's a lot of memory care out there now too. But again, it's still assisted living.
Right. And you're right. It's not cheap.
And assisted living costs are climbing as well.
Wow.
Yes.
Well, guys, I want to thank you for coming in today. Believe it or not, we are just about out of time. So Tiffany, Clint, Lisa, thank you from Maplecrest Nursing and Rehabilitation. And I'm going to encourage people to call and visit facilities now. So who would they call for a visit? Would that be you, Clint?
Would be
Tiffany.
me.
That'd be
Tiffany.
you. All right,
Yes,
Tiffany. Tiffany, if they
Tour.
wanted to get a hold of you, what's a good number for them to call you at?
It is 330-503-5216 is the admission line.
Okay, just call Tiffany. And if you've listened today, obviously you can hear that she's a very approachable individual. So, start
welcome you.
So start the planning now, right?
Right. And they can also call the building, 330-755-1466. Again, we look at the individual and try to help navigate through these very difficult decisions, and everyone is unique, every decision.
Well, having been through your facility, you walk that walk, to say the least. So,
Yes.
All right, guys, thanks again.
Thanks.
Okay, this
Thank
is
you.
Leo Daprile. This is the Gem Young Wealthcast. We'll be back after this break.
At Gem Young Insurance and Wealth Advisors, we know every financial journey is unique. That's why our team of financial planners, paraplanners, and service professionals work together to provide personalized strategies for a work-optional lifestyle, investments, and risk management. We're here to help you plan for today, protect tomorrow, and enjoy the life you've worked so hard for. Take the first step toward financial confidence. Call Gem Young Insurance and Wealth Advisors at 330-533-6936 to schedule your fit meeting today.
Hey, it's Medicare Jer here from Gem Young Insurance and Wealth Advisors. Medicare can feel confusing, but I'm here to make it simple. With the right Medicare Advantage or Supplement plan, you can worry less about unexpected healthcare costs and focus more on enjoying life. Let's make sure you've got the coverage that fits your needs and gives you peace of mind. Call me, Medicare Jer, at Gem Young Insurance and Wealth Advisors today at 330-533-7941 to schedule your appointment, and let's get your plan in place.
By calling this number, you will be speaking to a licensed insurance agent to answer your questions or provide additional information about Medicare Advantage plans, prescription drug plans, or Medicare Supplement insurance plans. This is an advertisement for insurance.
At Gem Young Insurance and Wealth Advisors, we make planning for your future simple by offering both insurance and wealth management under one roof. Our team helps protect what matters most while guiding you toward your financial goals, whether it's safeguarding your home, health, business, or planning for a work-optional lifestyle. With everything in one place, you get seamless support, personalized strategies, and peace of mind. Call Gem Young Insurance and Wealth Advisors at 330-533-7941 today to schedule your fit meeting and experience all-in-one protection and planning.
Now, back to the Gem Young Wealthcast, brought to you by Gem Young Insurance and Wealth Advisors. Once again, here's Leo Daprile.
Welcome back to the Gem Young Wealthcast. This is Leo Daprile. Well, I hope you enjoyed the program today. I found it incredibly informative. We did a couple of things with the show today. I wanted to draw out the emotional impact of the conversations many of you don't have with your kids, or many of you kids don't have with your parents, but you're in a position where you're going to have to make some life-altering decisions. That's what this whole series has been about, helping you make decisions and helping you have the conversation. So putting people in front of you that you're going to be needing and using in these scenarios. So I had a great group today, Lisa, Clint, and Tiffany from Maplecrest Nursing and Rehabilitation. And we wanted to give you some insight, not only to the the emotional decisions and how they're helping you navigate through those, the challenges based on what type of insurance product you have, what coverage you're going to have. So this is a very complicated scenario, and most of you are not prepared for it. So that's been my mission all month, is to have these uncomfortable conversations and challenge you to have the uncomfortable conversations like we talked about earlier in the program. Life insurance is a pretty word, but it's really death insurance. But we call it life insurance because it sounds prettier, but it doesn't change the outcome that all of these decisions affect your mortality. So, and they're going to affect your parents' mortality. So know financially where they are, and know what their wishes are when they're healthy and when they're in a position to have these conversations with you, because they're all going to happen. Everybody wants, there's an old expression, and I used this in the last show, that everybody wants to go to heaven, but nobody wants to die to get there, right? So, but we do. And what does that process look like? And what demands are we putting on our caregivers because we haven't had these conversations? I mean, how many of you out there, and we talked about this in the first segment of the show, saying that the kids will say, Mom, Dad, you'll never go in a nursing home, I'll take care of you. But then you get to the point where you can't care for yourself and they can't care for you anymore. And you've created a situation of guilt, in some cases shame for these people. And a lot of you feel this. And I hear these things from my clients. So that's, again, was one of my reasons to wanting to do these series, and not just have a happy-go-lucky conversation, but have real-life discussions, because that's what we do here at Gem Young Insurance and Wealth Advisors, is we have all of these conversations. We call it the conversations that need to happen, but we do it with love and respect with our clients. We do it with our family, and we want you to do it too. We know these conversations can be emotional because it's talking about potentially end of life, but we all get there. So how do we want it to do it? What dignity do we want to have? How prepared do we want our family to help us and for you to help them? These are all key things. And if you wait till the last moment, then it's crisis for everybody. It's high emotional, it's difficult decisions, and you're in a situation where you're having to make decisions of things you don't know about, right? That's what we want you to avoid. So again, the podcast is available right after the show, anywhere you get your podcasts, and we are live on our YouTube channel today too as well, so check it out. This is Leo Daprile. This is the Gem Young Wealthcast. Until next time.
At Gem Young Insurance and Wealth Advisors, we make planning for your future simple by offering both insurance and wealth management under one roof. Our team helps protect what matters most while guiding you toward your financial goals, whether it's safeguarding your home, health, business, or planning for a work-optional lifestyle. With everything in one place, you get seamless support, personalized strategies, and peace of mind. Call Gem Young Insurance and Wealth Advisors at 330-533-7941 today to schedule your fit meeting and experience all-in-one protection and planning.
At Gem Young Insurance and Wealth Advisors, we know insurance can feel complicated and overwhelming. That's why our team is here to listen, understand your unique situation, and provide solutions that work for you. From home and auto to life, plus a team dedicated just to commercial insurance, we help protect what matters most without the stress. Don't wait until an issue arises. Call Gem Young Insurance and Wealth Advisors at 330-533-7941 to schedule your fit meeting and get the protection you need today.
Hey there, this is Dan Rivers. Friends, if you're planning for a work-optional lifestyle or looking for financial insight or just want real conversations that help you make smarter decisions, we've got you covered. Listen to the Gem Young Wealthcast anywhere you get your podcasts, including Apple Podcasts, Spotify, and the iHeart app. And now you can watch the full video podcast on their YouTube channel. Gem Young Wealthcast with Leo. New episodes every week featuring professionals, local leaders, and conversations that matter.
Join me every week where we talk anything and everything about your money. Have a topic you want to hear more about? Email Katie, that's Kayti, at gemyoung.com. You can find us on Apple, Spotify, and the iHeartRadio apps. Until next time, this is Leo Daprile.